something called as a Flail chest. Now this came in your exams. What is a Flail chest? A Flail chest means there is a confusion about even the definition. The definition says that there should be at least 2 ribs. Some people say 3 ribs. So 3, I will not say 3, I will say there should be at least 2 ribs that are broken at 2 or more points. Okay, so that is all about this point. Now, so that is something called as a Flail chest with 2 ribs broken at 2 or more points. Now, what is the main problem with a Flail chest? So the main problem with a Flail chest is these are usually due to a high impact injury. And that obviously means there is an underlying lung injury, there is an underlying heart injury that usually accompanies this. Now, if you are talking about in the high impact, the segment that is formed or the Flail segment that is formed, that segment undergoes a movement that is called as a paradoxical respiration. Okay. Now, if it is a paradoxical respiration, that means during inspiration, when the chest should move out, the fragment moves in, and the vice versa during expiration. So this is a paradoxical respiration or a paradoxical movement that is seen. Now, what is important is that these patients, due to the paradoxical movement of that fragment, can land up by producing an hypotension because of the compression of the mediastinum. Because of the compression of the mediastinum, you can land up by an hypotension. Okay, so please understand this. Parallelly, there could be a lung contusion, which is also responsible for and hypoxemia. So hypoxemia can be produced due to many reasons in this case. What is the treatment? Now, the first part of the treatment is that should I give an ICD, yes or no? The answer is yes. Even if there is no pneumo or a hemo, there is a group of surgeons who prefer an ICD, but this is with a questionable intent, because they say that majority of the patients are at a very high risk of a delayed pneumo or a hemothorax. So it is better to give a prophylactic ICD, but yes, that can be questioned. Now, when to intubate and put the patient on a ventilation? Remember, the basic idea is whenever there is a fracture fragment, historically we used to pull this fragment out. Nowadays, we don't pull the fragment out. We place a push for the fragment from the inside part of the thorax. So that can be only done when you have inflated the lung by a ventilator. So the question is, when will you consider for a patient to be put on a ventilator in a Flail chest? Number one, intubate the patient when or when to put the patient on a ventilator. Sir, number one, the patient has a respiratory rate more than 35 or less than 8. The oxygen saturation falls less than 90. Carbon dioxide has increased to more than 55. Okay, or the patient has a labored breathing. Okay, so these are the indications that you are required to take the patient to a ventilation. So, ladies and gentlemen, this completes all the 6 lethal injuries. Yes, sir.
When to fix rib?
Right.
Flail.
Something that I was trying to avoid, because a new school of thought that has come up is that they say that if you are planning to do a thoracotomy for other reasons, so for example, this is a patient with an lung injury and the lung is actively bleeding, and you need to go in to do a pneumonectomy or a lobectomy or a mediastinal injury. Now, their school of thought says that it is better to consider a flexible titanium plate with screws on the fracture fragments of the rib, with an idea that the paradoxical respiration in the past will be bad. But this idea is not very well accepted Hence, the internal splinting by ventilation is still the number one treatment for a flail fragment. Okay.
Sir, any role of strapping outside the chest wall?
No, absolutely not, sir. Absolutely not. If you strap that thing, what are you trying to encourage, sir? You are not trying to encourage anything. That fragment that is mobile, that fragment will always now again produce a big contrary force on the underlying lung. The hypoxemia factor, all the hemodynamic instability factor will be the same. So you are not doing any help. If you had not strapped it, on the other hand, that would have helped because the lung would have expanded. The chance of that lung getting injured will be much less. So don't do a unnecessary strapping of the flail chest. It doesn't. Sir, this is not a femur fracture or an ankle fracture. A rib fracture is a dynamic problem. And hence, please don't strap the chest in a rib fracture. Okay? Hello?
Sir?
Yes.
Sir, is a flail chest and stove-in chest are same thing?
Right. Absolutely right, sir. Now, the stove-in chest is technically an older term. Flails had been classified older. People used to classify flail chest as the type of the chest. Example, lateral flare. Example, anterolateral flare. Anterolateral is a very difficult one, or some people have a central flare. Central flare is probably the worst, in which the central fragment, along with a couple of rib breaks, and it is this fragment which, when broken, compresses upon the mediastinum. That is bad. Anterolateral, I think, is understandable. It takes a part the costochondral junction of the rib, and lateral is lateral. Okay, I think that